Today we're going to go over reported findings. We're going to go over what we found after we took your x-ray. Okay? We only have one spine for the rest of our lives. We want to make sure that we take good care of it. This is a typical spine. These bones here, what they do, they protect the spinal cord. Sometimes these bones can shift and go out of place due to certain stresses. Physical stress, repetitive stress, chemical stress, and once that happens, we call it subluxation. Now this is what a subluxation looks like from the side view of a vertebra, okay? So when the bone shifts, it shifts and I'm going backwards. Once that happens, what happens to the nerve inside here, it actually pinches and irritates that nerve. It's going to cause you that pain, muscle spasm, irritability, or decreased communication from the brain to the body. What does that look like to you?
Very straight.
Very straight. A very straight spine. So imagine the spinal cord inside here being tugged and pulled. Okay? Also what you see is you see a beginning stage of osteoarthritis. Very beginning. What we see that's good here, we see good disc space. This is space between each vertebra. This little white line is just the bone is starting to wear down. And that's osteoarthritis, which is a normal process. 6 months ago, you probably didn't have neck pain. It could have been occasionally. The problem is there. Pain is always the last thing to show up and the first thing to go away. And what will happen is that, left alone, of course, the pain will go away. It always does. That's the smallest portion of the nervous system. We've just gone over what we found on your x-ray, okay? And what we can do to help. We're going to go over with the second portion of your reported findings. The treatment options, or how long it's going to take to get better. Well, typically a patient is going to come into the office with pain, some kind of crisis. We're going to find the condition and we're going to stabilize it. This is symptom relief. This is your first portion of your care plan. Of course, there's 3. Symptom relief, corrective care is the second, wellness or elective care, which is the third. Symptom relief, what we're trying to do is just get the patient feeling better. The average patient says they feel better somewhere around 12 visits. If your pain scale is a 10, by visit number 12, it should be around a 6. The pain is still there, but not steady. Okay? Then we go to corrective care. Corrective care is what we want to do is stabilize and strengthen the area. Trying to get those curves in your neck more of a C shape. We're going to be talking about how you should be sitting at your desk when you're working. How many pillows you should be using at night when you're sleeping. So now we've just completed our first reported findings with a wonderful patient here, and we're going to show some of what we do as far as therapy is concerned. Now this is going to go up and down your back. These are roller tables. They're very comfortable. We use this. That's it. And take this and have a great day.
Thank you. All right.
Bye. You're welcome.
Thank you. We'll see you on Wednesday.